Hi, this is Piyush Bhargava and I have an interesting case to share with you. These images are from a female patient who was recently diagnosed with a GE junction tumor and an FDG PET-CT was performed for staging. Let's start by looking at the whole body rotating image. The rotating image shows a large focus of hypermetabolism extending from the lower chest into the abdomen. We see physiologic urinary bladder activity, and behind the urinary bladder we see another focus of hypermetabolism. Now let's take a look at the fused PET-CT images. The focus in the chest corresponds to mural thickening of the lower esophagus, which is intensely hypermetabolic and extends into the GE junction seen here and here on the fused PET-CT image. The focus in the pelvis is seen here as a focus of hypermetabolism behind and towards the right of the urinary bladder activity. The primary is a GE junction tumor extending from lower esophagus into the stomach. We don't see any evidence of regional lymph nodes, although remember that for lower esophageal, GE junction and gastric cancers, the way to evaluate for regional lymph nodes is endoscopic ultrasound guided biopsy. We do FDG PET to look for distant metastases. So what explains this focus in the pelvis? This was further evaluated by a CT of the abdomen and pelvis, and it corresponds to mass-like thickening of the endometrium. Here's the uterus, and inside it is where we see intense hypermetabolism. This was biopsied and turned out to be an endometrial cancer of endometrioid variety. So always remember that when there is a focus of hypermetabolism which does not conform to the biology of the primary tumor, think of a second synchronous primary malignancy. The caveat to that, especially in patients with incidental uterine activity, is that this could be physiologic, especially in a female of childbearing age group. So let's look at this companion case on the next slide, where on the rotating image we see a focus of hypermetabolism in the pelvis, and this focus corresponds to the uterus, which is seen here. The uterine cavity, which is normal in contour, is slightly distended, and this was physiologic activity of FDG from menstruation in a female of childbearing age group. So the two teaching points of this case are looking for a synchronous primary and differentiating incidental focal hypermetabolism in the uterus from physiologic activity. Thanks for watching.